So, you can hear me there? Can you hear me? Okay. Yeah, good evening, viewers and all Superlife members. Well, sometimes it's like this. We are starting very late. Just bear with us, and any inconvenience the delay may have caused you, we apologize. We apologize sincerely for starting very late because of technical issues that we have already we have already corrected now. So the new link has been sent to you, and from that link now you can see me vividly. You can see me clearly. So the topic remains the same. What was sent to you before is the same topic. We didn't change it. The topic is the cat before the horse. Round pegs in square holes is synonymous with improper diagnosis, prior administration, interfaced with non-compatible product prescription and duration, a challenging task. It's a challenging task with widespread consequence in Superlife supplementation therapy. So this contest, we will propose a panacea or solution to the issue at hand. So what I said, the cat before the horse, we know what is supposed to obtain. You put the horse before the cat. The horse in the front, the cat at the back. So when the cat now comes before the horse, it's a misnomer. So when you put a square peg in a round hole, it cannot fit, it's a misnomer. Is it not? So now we are saying the cat before the horse, the square peg in a round hole is the same thing with improper diagnosis before administration. Particularly when it is compounded with wrong prescription and duration of use. So we are saying it's a challenging task with widespread consequence as far as Superlife supplementation is concerned. So this lecture is providing a thematic or contextual solution to the aforementioned. I want to draw our attention to medical intervention or therapeutic medicine. Therapeutic medicine is the use of drugs, use of injectables in the management of ailments or diseases by medical personnel or in the medical profession. Our supplementation is also therapeutic because it produces therapy, or it's a therapy that produces results. But the two are on two different sides, but complementing each other. And you cannot dispense with medical intervention because you are dealing with Superlife ST30 products. You cannot dispense with it. You cannot do away with it. Why we cannot do away with it? Because we are talking now improper diagnosis. When you don't diagnose, you didn't find out well what is wrong with a particular person. That one is a problem. Before you start giving the product, you didn't find out the proper diagnosis. Also, you now administer Superlife products wrongly. You give the wrong product for the wrong disease, or you give the wrong product for the right disease. Not only that, the prescription, how is he going to use the product? How long? You didn't do the right thing. It's going to be a very challenging task or bottleneck in Superlife efficacy and administration. So that's what we're dealing with today. Improper diagnosis. wrong prescription, wrong duration, wrong product administration. So how it affects the success of our Superlife supplementation. Are you getting it? So that's what we're dealing with. Now, our aim is to get satisfaction to the end user of our products. Superlife products, the 6 of them or the 5 major of them, they are health therapeutic products. They are therapies that produce results. In other words, they bring solution. The person gets well. What other conservative medicine do, or conservative medicine can do, Superlife ST30 products, SIC products, SNC products, as they like, they can also do it. Now, we can be successful if our diagnosis is correct. Somebody comes and presents with a problem. Say, this is my problem. First of all, you ask, where were you told that is your problem? I have low blood pressure. I have hypertension. How did you know that you have hypertension? I have been clinically examined by the doctor, by a healthcare giver, and I found out that I am hypotensive. That's my blood pressure is low. How is it low? That the diastolic is comparatively less than 60, and the systolic is 90 below. Of course, and you say, where is the result? You see the results. Or where did you get the diagnosis from? It tells you. So you confirm that diagnosis. If you confirm that diagnosis by, okay, accept it because you believe the person, or you say, can you redo another one? Can you redo another one? Another diagnosis, and the person accepts, then you confirm that diagnosis. You now know that the person has what? Hypertension, low blood what? Pressure. So that's the best way to start. But if the person just tells you, I have low blood pressure, no indices, nothing to indicate that the person has low blood pressure. You just say, low blood pressure, you just say, let me give you our products. And you don't even know the product to give. You just say, okay, as far as blood pressure, you give ST30. Are you getting it? You give ST30. First and foremost, you didn't confirm the diagnosis as low blood pressure. Secondly, you don't know which product to prescribe. You now prescribe ST30. And you now say use once daily. For how long? So use for 1 month. That is one, diagnosis is wrong. You didn't follow the proper diagnosis. Secondly, the prescription is wrong. Thirdly, the product duration use is also wrong. And the person will take the product and say, I've used the product for 1 month, it didn't work. That is why we are talking about network. Their product doesn't work. The product is working. It's your process, your style, your procedure that you didn't follow. So diagnosis is the first step in your business in administering Superlife products. Diagnosis is the first step. Diagnosis is that you have to be sure of the disease condition or what that person is presenting with. That is what that person is presenting with. Once you are not sure, then you now know which of the products to administer. Why? Disease condition most of them have similar symptoms, similar clinical symptoms. Is it not true? So somebody that is presenting with shaking, vomiting, has chills, that is, is having temperature, is shaking, is vomiting, is sweating. Malaria can do that. Typhoid fever can do that. Bacteria, other bacterial infections can do that. Are you seeing your similar symptom? But you have to, there's a way your diagnosis will separate one from the other. And the diagnosis could be clinical diagnosis, laboratory diagnosis. So separate them. So it may not be your work, but it's also your duty to know whether the person is coming up with the right thing. If you say, okay, somebody say, I want to buy your product for what? He said, I have asthma. You tell the person, is it asthma? Say yes. Do you have any reports for me to know it's asthma? The person say, I know myself, it's asthma. I'll be suffering it. Yes, you believe that. Just ask the person, like, what do you experience? They will tell you. What have you been using? Will tell you, okay. Your question, you are finding out certain things about that person is to confirm the diagnosis he has told you that he has asthma. Is it not? Then you not know what to give to the person. So that is why I say putting the cart before the horse. When you don't do the right thing, you end up doing the wrong thing. So this seminar is particularly for us to go back to the drawing board, because we hear complaints of our product use, several complaints that the product is not working. Why is it not working? What worked for other people, but people are complaining it's not working. And we have found that from the complaints, there is either improper diagnosis, wrong diagnosis, improper product administration, not administering product well, and not only that, the wrong duration, wrong timing. Follow up and we resolve those issues. Some people that said the product was not working eventually admitted that the product is working. So that is what we are talking about. From the beginning, the right diagnosis. Don't be afraid to send the person send the person for scan, to send the person for laboratory test, for you to confirm. Are you getting it? Now, then don't wish away medical intervention. Like the case I mentioned, that someone that is having low blood pressure and is already fainting, it's already becoming unconscious. You go and administer your product to such person. No. You send the person for clinical intervention to the hospital, to the clinic to be revived. They have to revive the person, bring the person back to consciousness. Somebody that is already subconscious because the BP has gone below. He doesn't even know what is happening. You say, give ST30 to how will you put the ST30 in the ear or the buttocks? The person must be revived. Are you getting it? Revive the person. How do you revive the person? Emergency to the hospital. When they flush the person with normal saline, the BP will go up. It will just step up. And the person will come out of subconsciousness or unconsciousness. I'll be asking, what happened to me? Then, after then, you will not know your administration will not continue from there. Because the person will be stabilized. He will be stabilized. Then your administration will continue from there. You will not give the right administration. Note this one. Hypertension and hypotension, they are two different. They are diseases of two extremes. One is high blood pressure. The other one is what? Low blood pressure. You give ST30 for high blood pressure. Will you still give ST30 for low blood pressure? Eh? But we have been giving it like that. It's not correct. Except you want to send the person to a different part of the world. High blood pressure, say the pressure is high, you give ST30 to bring it down. Is it not? To control it. Now the pressure is low. You still give ST30 to just finally send the person away. No. You don't give the person low blood ST30. because pressure is already low. You have adduced now that correctly ST30 is to minimize blood pressure. So the person will be normal. Is it not? From high to normal. Also low, you're supposed to take low to normal. When you are when you are treating high blood pressure, it's not to take it from high blood pressure to low blood pressure. It's to take it from high blood pressure to what? To normal blood pressure. So low blood pressure, if you are taking it, what do you take it to? To normal blood pressure. Low. Do you reduce it further to low or to lower? It's death sentence because the low is even risky. So that means giving ST30 for someone that still has low blood pressure, you don't know what you are doing. Some of the people we give our product to, that we didn't find out what was wrong with them, that they had low blood pressure. Instead, we were confusing it for high blood pressure. Some ended up revived. They revived most of them in the hospital. Some we didn't see them again. We didn't know what happened. I will just conclude that, oh, my product have taken care of them. My product helped that person. That person has got solution. Not knowing that some of them ended up almost dying because we didn't see them again. There's some we eventually saw and said that your product almost killed me, but it was our own fault because we didn't follow the right diagnosis and the right prescription. So don't wish away medical intervention or clinical intervention that we deal with therapeutic supplement, Superlife, does not mean that medicine has failed. Treatment that they used to use drug or injection for has failed. It didn't fail, oh. They are still on their own. Are you getting it? So when you are supposed to send somebody for medical intervention, you want to give your product, no. Appendicitis, someone that has appendix, intervention. A woman that is pregnant that could not deliver, and the scan says the delivery will be difficult except it goes for CX, that is cesarean section or surgery. You say, no, I must treat with my product. Superlife. You say, no, I must treat with my product. How can you treat what they are going to use surgery to take away? You treat it with your product? No. That area of medicine, you don't go there. If after the surgery, the person has delivered, he said, which of your product can help me? There are many. Are you getting what I'm saying? That is so. When you start giving your product, in that case, you are doing wrong prescription. You are putting the cart before the horse. We are creating problems. What is it? Someone that's going to deliver with a cesarean section. You are giving the product. Say, take this one will help you. If you want to sell with dignity. Because the product is for a purpose. You are giving the product for you to have solution, provide solution for that person. It's not just for, as you are providing solution, you are creating health, and that health you have created will be giving you wealth. So they go together. So don't wish away. I repeat, don't wish away medical intervention. Because some of us, by overzealousness, we wish away medical intervention. I'm telling you something, the drug does not work. The drug does not work. Your product can complement a drug to work. If the drug is not acting, your product can complement it to work. There are some places your product does not need to come in. The drug first before your product comes in. That's why the producers of Superlife did not say they should stop using drug. Any person that is using drug. Did he say it? He didn't say it. He said, but you can use your product to help that person where the drug is not active. Your product can complement and make the drug active because it will provide a very sound immune environment for that product to now start working. I don't know if you get what I'm saying. Someone that is shouting chronic headache, my head, my head, my head. Which is the best way to calm that person down? Is it our product or medical intervention? It's medical intervention. Take the person to the hospital, give him bed rest, administer injectables and other treatment. The person will calm down. When the person calms down, and you come up with your product. Why there are other cases that your product is very useful? Some they have given conventional treatments, it didn't. They have not really got the result. Your product comes up and delivers the results. Why some, even without going through any treatment before, your product does the result. Like somebody I've told you that he has asthma. He has asthma. Even if you don't ask the person which drug are you taking, we have potent product for asthma. So you give, provided you give the right dose and give the right duration. Of course, you know asthma has no perfect cure. So telling somebody take our product for 2 months, you'll be okay. You are a liar. That's a wrong duration. It's a wrong duration. Sickle cell anemia does not have cure, no medical cure. But your product can stabilize that person, that the person will not have crisis. The person will be leading a normal life. So someone that is leading a normal life does not have crisis. It's as good as someone that does not have it, isn't it? But telling the person, just take it for 2 months, you'll be okay, you'll be perfectly okay. You know. That's what we want to avoid. It's wrong prescription, wrong timing. So these cases, I will not be able to come here and be at light mentioning all diseases. Say, dude, I mentioned this, otherwise we will not live here. But I only cite some major or some diseases. That is why we talk about our manual, Superlife manual. That if the manual, we have this manual, we recall back to the manual. Okay, somebody just tell you, I have this. Okay, I think this thing should be a Superlife manual. You go to your manual. The person may not be able to explain well, but your manual will explain it well. We have our manual is ready. Our Superlife manual is available. They have disease classification from alphabet A to alphabet Z. They have product analysis of all Superlife products from ST30 to SNC to SIC to SC Plus to XROC to Supercell Tech. They were all analyzed. They were broken down in terms of administration, in terms of age administration. It was broken down like that, even up to the duration you will use it, continuation therapy, immediate therapy, and continuation therapy. They are all in the Superlife manual. So if you get the manual, you will be able to resolve those challenges of improper diagnosis, improper product administration, improper prescription, then improper duration. The manual provides answers to all these ones. So we should be careful in our approach to clients when they present us with problem. So as I've said before, I said don't wish away medical intervention. Medical intervention is medical intervention. As long as you can tell your client, say, don't stop using the drug they gave you, that means you still have respect for medical intervention, because your medical intervention does not affect your product. But wishing it away can affect the efficacy of your product, because some condition need stability from that end before you start giving your product. Some condition need perfect diagnosis before you start giving your product. And all this area, perfect diagnosis, they are all medical intervention. So that is what we came to talk about today. Then, secondly, Don't be afraid to administer the right product once you are already aware of the right product. Don't be afraid to administer it. And don't be afraid to ask questions. Superlife is positioned in a way that you have downlines, you have success lines, you have your leaders. So don't be afraid to ask questions. You can always go back to ask questions. You can always consult. You have groups. You can only have recourse back to your leader. Please, I'm confronted with this. What do I do? I'm confronted with this. What do I say? That's what we're talking about. You don't need to be afraid. Now, STC30 is a general purpose product. Now it has been enhanced. It has been enhanced and upgraded from generality to it's now taking some specific role. In other words, it can do some specific health issues ordinarily than before. So if you now have specific health condition, for example, like macular degeneration of the retina, it's a eye disease or eye problem. We know perfectly that our product for eye care is SNC. You don't need to be afraid to administer SNC. Then you probe. Are you sure of the diagnosis? Say yes. This is what they told me in the hospital. How long have you had it? They will tell you, I've been having it for the past 5 years. Okay. Can you see clearly? Say, I'm seeing clearly, but sometimes I cannot see like this. I cannot see central, something in my front. I cannot see it clearly. You are sure of the diagnosis. You will not tell the person. He said, the person told you now for the past 5 years. Telling the person to take your product for 1 month and 2 months, the person will be okay. It's not the right prescription. The minimum, as I always said, for minimum duration to start is 12 weeks. 12 weeks is how many months? That's 3 months. That's the minimum to start. So someone that is presenting case of 5 years, you should tell the person that the treatment starts from 3 months, but we should place him on 3 to 6 months therapy. And at the third month from the 3 months, we start monitoring the progress. Start getting report feedback. Not after telling the person this is what you do, you forget about the person. You follow up. That's the essence of the person being your client. So how is it? He said, yes, it's improving. The 4th month, he said, yes, it's better. The 5th month. So when you are following up like this, you become more confident in your administration. So, but if you tell the person, he said, take it for 2 months. After 2 months, the person have not seen any results, they will say your product did not work. When the person is anywhere, he hears where they are mentioning Superlife SNC, he will say, don't buy it. The product is not working. Because you didn't tell the person the right duration. 5 years. If the person takes it, it gets result before 3 months. Kudos. That means your product is hyperactive. When you say 3 months start, but it gets result at 2 months, better. It is better to state the right duration. Then the person is not able to buy at that time. You say we'll buy it when money comes. But you have stated the right what? The right duration. The person that you told that is going to use the product for 6 months. If after 1 month, the person comes to meet you say, this is not working now. You have answer to give to the person. Because you stated it from the beginning. Are you getting it? Yes, it's costly, but the cost must not make you do the wrong thing. The cost must not make you do the wrong thing. There are ailments that just need, you can just tell person 1 month, 2 months. Are you getting it? There are ailments that you can tell person that. Someone that is suffering from ulcer. If you say, I have ulcer, I'm having ulcer, it comes and goes. Okay. It comes and goes. Even if you place the person on a month, the person will get results. Because it just say it comes and goes. But if it's telling you, it tells you the nature of ulcer, it's a chronic ulcer that I've lived with it for 10 years. When it comes, I'm in trouble. You don't have to place the person for just 1 month. You stretch it. You say our baseline treatment is 3 months. But I know you will get result before that time. So don't be afraid to give the right product. So don't be afraid to talk about the products. Hmm? Now, there are areas. So as I was saying before, I said, don't be afraid to tell your client the right product because you're already used to Superlife STC30. Because you are used to it. It's the first product that came out. So nearly every prescription, of course, it can be in nearly every prescription, but there are specific products. For example, now, someone that is presented with stomach cancer, if I thought you don't have any product to tell that person, you cannot do without telling the person about XCC plus. Are you getting it? Or someone that is coming with pie. You know what's pie? Or hemorrhoids. Pie is hemorrhoids. You cannot do without telling the person about XCC plus. Are you getting it? Don't be afraid. Don't say, can XCC plus get rid of pie? Is it not SC30? Pie, where is it from? Which part of the body is pie? It's part of the large intestine. Part of the colon. Large is colon. What is SC plus? Colon care. That is its work. It will get rid of it completely. So if you say you are afraid, I don't know, let me use our normal general purpose product, SC30. You might be having delay. So the specific product will do it as fast as possible. Are you getting it? So that is it. They're all cancer cases. You cannot treat all cancer cases with one product. The least administration for Superlife product for cancer cases is three. Three products. Three words, products. Read my lips and listen to me very clearly. Three products. If you don't know what cancer, go and find out what is cancer. You can't treat cancer, a disease condition that defy medical intervention. Even the radiotherapy or chemotherapy they do is just for management, just to see how you can carry the patient. Then you just say, go and take SC30. Go and take, just give one of the products. The person is going to spend money. Please, it's the three products. And the duration, the minimum duration is 24 to 36 weeks. 36 weeks, how many months? Is it not 9 months? So after that 9 months, you not think of how to adjust the therapy. It's 9 months, you not think of only three products. Depends on the cancer. You now know the three products to blend together. So you see, so you should not be afraid to do the right thing. So you see, I'm mentioning some specific disease because I know we come across these particular diseases. So all cancer cases, stomach cancer, all cancer cases, cervical cancer, all cancer cases, breast cancer, all cancer cases, Hodgkin lymphoma, or multiple myeloma, or myelomatosis, all cancer cases, cancer of the heart, cancer of the lungs, cancer of the intestine, all cancer cases we treat with 3 Superlife products. Then the area we determine which of the product. First, ST30 is in all of them. Are you getting it? Secondly, most likely SIC is in all of them. Then you now choose between SNC and SCC plus, but depending on the area where it's coming from. That means if you have stomach cancer, ST30, SIC, SCC plus. Are you getting it? Because of stomach, when I added SCC plus. So we could skip SNC, SNC. But alternative, we can also replace SIC with SNC. The three must be there. 3 products for cancer cases. So if you have been telling people buy only 1 product for cancer case, well, you just want to sell the product. Your administration of ST30, 1, you want to provide good health. You're providing good health, you also want to make wet. Don't forget, don't make wet at the expense of wrong health. Make wet as you give good health. Now, ST30 is a new improved product. It has 3 new additions that has upgraded it from what it used to be to what it is now. The 3 new additions are potent ingredients that have proven integrity and efficacy. They are golden kiwi extract, Actinida chinesis. The second one is sea buckthorn, Hypopha rhamnoides. Then the third one is prickly pear cactus, Opuntia egamane. Those are the 3 that were added. Now, these 3 ingredients, they gave more life to ST30. Now, start with the first one, the golden kiwi. Golden kiwi is a plant that has 2 shades, comes in golden and comes in green. But Superlife specifically chose the golden. And there was good reason why they chose the golden. The green, the Actinida delicosa, is less, active than the golden color. The golden has the greatest number of antioxidants that you can think about among citrus fruits and species. The golden kiwi feature in many parts of the body in terms of activity. That is why we say it has taken ST30 from general purpose to specific product. Because in the golden kiwi, you have ingredients that help to take care of the eye. You have lutein, you have zeaxanthin, you have xanthophyll, and you have retinol, and you have carotenoids, which are precursors of retinol. You now see that if you now give ST30 for eye-related issue, it will give you a better result than when it was not improved. Because originally, ST30 was not having lutein, was not having zeaxanthin, was not having xanthophyll, and was not having vitamin A precursor, which is carotenoid, beta carotenoid. Are you seeing it now? With this one, it enhances eye health, unlike before. So, if you are comfortable with less severe eye problem, you didn't give SNC, you can give ST30 plus this new improved ST30 to do it because of the blend now of this new new ingredients. Are you getting it? So it has not gone to the eye. It cannot feature in the eye. Now, not only that, it also features in the liver because it has This prickly pear cactus has pectin, which is a very important antioxidant. That pectin has to prevent fibrosis of the liver. Are you getting it? It prevents fibrosis of the liver. And with that, it helps to improve liver health. I know that our product that really does improvement on liver or that takes care of liver health is our Superlife colon care. Now we are not saying ST30 new improve can also do that because of pectin from the Opunta egamani. Now, skin susceptibility to ultraviolet light, photo damage on the skin is, is taken care of now by this new ST30. Do you know when you are giving this ST30, what it does, it makes your skin proof to sun rays, proof to electromagnetic rays, proof to ultraviolet rays. So it preserves your skin. So when you find yourself in a condition where you are exposed, your skin will not be susceptible to deformation or cancer. So it helps in preserving skin health or preventing skin damage by light rays or photo rays. And that is what our Super Cell Tech SS means. You know it? You know what Super Tech SS means? That's cosmetic that we have does that. We're not saying the ST30 can also do that. So when you have such challenge that has to do with skin, that has to do with skin problem, combine ST30 and the Super Cell Tech SSB cosmetic will give you a very potent result. So you see, it has gone away from just general, now it's not going to skin. Now it has also featured in your stomach or your colon or your intestine because of the content of from the golden kiwi. Now it also features in your respiratory health. We know about respiratory products, super root coffee. We also administer SNC as part of respiratory product, but this new improved ST30 can also feature in respiratory health because of the sea buctum. The sea buctum enhances respiratory health, so it features there. But the gamut of all I'll be talking about is perfect diagnosis, perfect prescription, then also do perfect product combination. You can combine products. It's not the wrong thing to combine products. ST30 plus SNC, ST30 plus SIC, ST30 plus SCC plus, ST30 plus SROC. You can combine them, provided you know the right diagnosis and you know the right ailment you are dealing with. Then lastly, before I draw the culture, I've just told you the three new additions. I'll be talking about ST30, the new improved severally. So I will not be able to talk more than that. We have dealt with it severally before. It's only when we are going to have lecture on only ST30 new improved that we're able to talk deep on each of the ingredients, what is their role in that ST30, and how they have combined their roles together to make ST30 a very powerful product. Now, lastly, the super root coffee. We just take it and tell people that it's just a coffee. We just take it as coffee. When we just tell people, where we are supposed to give super root coffee, we start giving ST30, we start giving SNC. Whereas the super root coffee will do it. That they call it coffee does not make it just a digestible coffee that like other coffee, like your green tea, like your Lipton tea. That is not the way super root coffee is. Super root coffee is a therapeutic coffee. A coffee that can cure dry cough that defy medical intervention. The Malaysian Prime Minister Dr. Tai Mohammed in 2002 that was giving testimony. I took a medicine from China that was made with tiger milk mushroom. His dry cough that didn't go went away. Just know what minister is. Minister can go to any of the hospital in the world. He went to the hospital, but dry cough could not abate until he took tiger milk mushroom medicine. Tiger milk mushroom is our super root coffee. Is there another coffee like that? And tiger milk mushroom contains beta glucan, which has polysaccharide and one of the most potent polysaccharides that deals with immune system and corrects respiratory health problem. He says ordinary coffee. Tonkat Halley has quasinoids. Quasinoids are pharmacological, toxicological, and bioactive ingredients in the world that have been assayed by several scientists who are looking for what called quasinoids is in superroot coffee. Then the marker has glucosinolates. Glucosinolate has high pharmacological action on nearly all parts of the body. Is that ordinary coffee? If you don't go and listen yourself very well. Superroot coffee is one of the most active ingredient or product of all Superlife products. So administer it as therapy, not just take it as ordinary coffee. For any problem that has to do with your respiration, do you know that superroot coffee can get rid of arthritis? When you talk about arthritic problem, superroot coffee can deal with it. Superroot coffee can be blended with SC Plus to deal with poisons or poisonous problem. So that is the last takeaway. Our superroot coffee should be administered as therapeutic coffee, not as just ordinary coffee. So we draw the curtain for today. We delayed. Yes, I'll take the question. Really, let me read for them. We'll read the questions now, we'll answer them. Then next time we'll come up on time. We are sorry for the delay.
There are some like the super and working and all that. Thank you, doctor. Then someone said, what about someone with low and sugar level? Low sugar level.
Yes, somebody would say, so somebody that has low sugar level. Low sugar level. That is somebody with hypoglycemia. High sugar is hyperglycemia. Now, low sugar is hypoglycemia. When someone is always coming up with low sugar, first of all, encourage. Say, take more of carbohydrates. Are you getting me? Tell the person to take more of what? Carbohydrate food so that the sugar will go up. Sometimes take mineral once in a while. The product that you can give, you can only regulate the person's sugar with SIC and SROC. This same coffee I mentioned the name. Take them. It will regulate it. It will not bring down the sugar again. It will regulate it. But tell the person to boost it up initially. First of all, boost it up first. Because when it's too low, you'll be dizzy. You can even fall. Do you know? Let me tell you. Low sugar is hypoglycemia. And there's an extent it will reduce. It will lead you to hypoglycemic shock. Hypoglycemic shock will take you to hypoglycemic coma. And from coma, the person dies. So not only high blood sugar gives coma, low blood sugar also what gives coma. So, but attempting to give NC30 in that condition is not advisable because you give NC30 for the upper. But SIC, even if it has power to reduce, but it will not reduce sugar because SIC works with the immune. The immune system is already reading low sugar. So SIC is to balance the immune system, so it will not crash it. Either it will enhance the immune system to redirect the system to respond more so that the sugar can, elevate as the person is eating, as the person is drinking. That is what SIC does, is to work with the immune system to work in the positive direction against what the person is suffering. So that is it.
Thank you very much also for this explanation. We are grateful for this life. Okay. One said thank you very much. Let me go to question. Said Superlife products is well, thank you. Sure. How do we help someone that is diagnosed for colon cancer?
Yeah. How do we help someone? Now there's a question, how do we help someone that is diagnosed of colon cancer? During my course of my lecture, I said all cancer cases How many products? 3 of our Superlife products. Now, someone has been diagnosed of colon cancer. Now, the 3 combinations, STC30, SIC, SCC plus, those 3. Are you getting it? If you can substitute at the 6th month, you can replace SIC with SNC, but the admission continues. Now, cancer treatment is 24 to 36 weeks, the baseline. From there, you now adjust. Now, the combination I just mentioned for you, ST30, morning and night, SIC, morning and night, SCC plus, morning and night for the first 3 months. Then you reduce SC plus to once daily, but you still maintain morning and night for ST30 and SIC. For cancer, that is it. That will make the patient to get faster, improvements. Otherwise, cancer has no other therapy. That is the therapy we can give as far as our Superlife product is concerned. Because the person can be going for chemo if he wants, but it will improve his chances of chemo. When he gets to a chemo center, they might even shift the chemo. When they examine other areas, those this person is improving. That's it. Go for endoscopy now. Endoscopy or colonoscopy to check the level of cancer of the colon. By the time he has taken your product for 6 months, tell the person to go for colonoscopy or endoscopy to see the response rates. You will see there will be improvement. Yeah, that is it. Read it.
The 3 products we use for cancer, they're taken together or in particular ones to be taken for time and continue with the other one.
They are taken together. How would the product be used for colon cancer? That's what I've just said now. I said you take it ST30 morning and night, SIC morning and night. If you didn't use SIC, you use SNC morning and night. The SCC plus, I say use it morning and night for the first 3 months. That is SCC plus, only SCC plus. Then you now reduce SCC plus to only nights. The other 2 continues morning and night. It's cancer we are talking about now. Except the person says otherwise, please, I don't have much money to buy all this. We tell you, but that is the normal administration. If you choose to take it 1-1-1, is well, but that is our administration. That is our protocol. If you go to the manual, if you go to the Superlife manual, that is how it is. In this manual, in the follow-up, they will tell you several other things you will do in the follow-up. They are inside the manual.
The value. Doctor was sure that affects man and leg who the person can control. He's talking about which product to use for stroke.
So you say, which product do we use for stroke? Stroke. Now, of course, stroke affects the hands and the legs now. It causes some can suffer quadriparesis or all the 4 limbs can just have problem. The 2 hands and the 2 legs on one side, but mostly it goes on one side. So our product that we give for stroke is SNC. But when you are seeing that the hand and the leg they are affected, you have to combine SNC and STC30 because it has been improved to work on the neuron, to work on your neurological problems. The ST30. So you combine it. The person will have a faster. Then the person must take SNC twice daily for the stroke. He can choose to take ST30 once, but the SNC must be what? Twice daily for the stroke, or what called cerebrovascular accidents. That is stroke. Goiter. Goiter presents in different cases, in different forms. You have thyrotoxicosis, goiter will come. You have hyperthyroidism, goiter will come. You have Graves' disease, goiter will come. So, as far as you are saying goiter, eh? From the diagnosis, once you have seen the diagnosis, but you are seeing physical goiter, you combine ST30 and SNC for goiter. ST30, morning and night. Morning and night. SNC can be once, but ST30 must be morning and night for the goiter. Baseline, 3 to 6 months. Not just a 1 month, 3 to 6 months. S30 morning and night. If he has money, SNC morning and night. But if he doesn't, SNC morning and night, SNC once. When you take ST30 early in the morning, as early as 6, in an hour's time, you take your SNC. If you want to take it in the morning, then the same thing in the night. If you don't want to take SNC in the night, you take it in the night. After taking SNC, 1 hour, you take your SNC. Are you getting it? So that's how I do it. I think so I should expand. Okay, I should explain. Prostate. Yeah, the questions are so many. Okay, I asked read them. Okay,
They will make them and say, what about high blood pressure and low blood pressure?
I have talked about that.
Was diabetes fix? How is the advantage? Which of our products can be recommended, sir? This person even died in London hospital. Maybe to marry the prostate about. They said, what about someone who has been down for years with diabetes and high blood pressure? Products.
Okay. Now the question is: someone that have been down for a very long time with diabetes and high blood pressure. That is one question. Then, how do we manage? How do we prevent death from prostate cancer or prostate enlargement? Okay, we start with someone that have been down with blood pressure and diabetes. First and foremost, tell the person to always take the medication that they have given to him or her from the hospital. Always take your medication. Those two ailments, the medication is just a continuous medication. Continuous medication. When the person is taking it, then you blend with our own ST30 and SIC. If the person telling you I cannot tolerate ST30, give SNC and SIC. SNC can completely do the work of getting rid of diabetic issue as ST30 can do it. Some people, when they take ST30, their body don't tolerate, they don't easily tolerate anything that has to do with sugar. Whether it's sugar, no, our sugar is fructose, not the one that increases blood sugar anyway. But since it has to do with sugar, some systems don't tolerate it. So instead, you give SNC. Eh? It will do the same thing and regulate with SIC. Then for the prostate, they're going to call prostate. Our product can be taken prophylactically to prevent and can also be taken to give solution when the problem is already there. When the person, if you want to prevent all this, tell the person to go for abdominal scan. A man, it's a man we're talking about, not woman. No. It's only man that has prostate cancer or prostate enlargement. Women not get prostate. Tell the person to go for abdominal scan. Then, if the abdominal scan shows that the prostate is enlarged, that it has prostate enlargement, or what we call benign prostate hypertrophy, benign prostate hyperplasia, or prostatitis. That is the prostate just enlarged. It's not cancer. Tell the person to go and confirm with PSA, prostate specific antigen test. to see the amount, the level of that antigen in the blood. When the person has done that, we are sure that it's not cancer, but the prostate is only enlarged. Give our product STC30, SIC, twice daily for 3 to 6 months. Are you getting that? If the person does the scan and see that the prostate is normal, it's not enlarged. Of course, as men, as we grow, the prostate increases. But the increase is not significant. So they will not say, it will say it's not enlarged. So they will say it's normal. Then you give our product as prevention. And what is the product? ST30. You can give ST30 and SNC. Take it every other day. You can take ST30 today, SNC tomorrow, ST30 next tomorrow, like that, every other day. Do it for 3 months or at least 2 months. You stop. Then later again, maybe 6 months or 8 months time, you repeat it. That's as a man, because as you grow old, so that's prevention. Are you getting it? When you do that, your prostate will not enlarge. Because of course, it's supposed to enlarge as you grow old, as we are aging. Now, the last one is the prostate cancer. As I've said, all cancer cases, 3 of our products: ST30, SNC, SIC. That's all.
Yes. Okay.
So someone with low sperm count, or depend on the duration. That is why I said our super root coffee should not be taken as a normal coffee. Anything that would deal with low sperm count, has no sperm count at all. Low, there's low. Oligospermia. No sperm. No, N-O. No sperm. Azoospermia. Or watery sperm. Or no poor viscous sperm. SROC. Super root coffee, morning and night. Then if you want to make it so effective faster, you now add the new improved ST30. It's final before 2 months. That's my, but give the person 3 months treatment. What did I say? 3 months. We have given somebody SROC. The person has 4 million, only 4 million cells as sperm, 4 million. So low. When he took SROC, only super coffee, for a month and 12 days, the thing became 10 million. A month and 12 days, not up to 3 months. So it became how many million? 10 million. So don't play with super coffee. So if I tell you, it's not just do a coffee. It's therapeutic coffee. We'll draw the curtain. Any other question should be carried to another time. Superlife, thank you very much. Hey, Chief Waziri. See my wife, you know my wife? This is my wife. So that is mama younger brother. Mm. Remove it from my neck.